If you take Adderall, Ritalin, or Vyvanse, or any stimulant for ADHD for that matter, there's a question spreading online right now that has a lot of people worried. Can my ADHD medication give me Parkinson's disease? I've read the studies, I've seen the headlines, and I know why this is scary, especially if you've been on stimulants for years or you're watching your kid take them every morning. Here's what I can tell you right now. The connection between ADHD and Parkinson's is real, but the story behind it is very different from what you've been told. I'm Dr. Zaid Fadul, founder of Bespoke, Concierge, MD. Over the next 10 minutes, I'm walking you through the major studies on this topic. No fear-mongering, just the science in plain English. And I'll tell you now, what the data actually shows will probably surprise you. Stay for chapter 3 because it flips the entire narrative. Okay, let's dive in. Let's start with the most basic version of the question. Does ADHD increase Parkinson's risk? The short answer is yes. There does appear to be a connection, and it isn't from one small study. The largest analysis on this combined 12 studies, over 124,000 people with ADHD and 1.7 million people without it, published in JAMA Psychiatry. People with childhood ADHD had about 4.7 times the relative risk of developing Parkinson's. Before you panic, let me give that context. The actual prevalence of Parkinson's in ADHD patients across these studies was about 2.7%. Without ADHD, about 0.5%. So yes, it's meaningfully higher. About 97 out of every 100 people with ADHD did not develop Parkinson's. A study from Israel tracking over 13,000 adults aged 50 and above found a 33% higher hazard, with earlier average age of onset. German, Swedish, and NIH data all confirm the pattern. The link is real. It's been replicated across countries. But most articles leave out the most important part, why these two conditions are connected. That changes everything. To understand the link, you need one word: dopamine. Dopamine controls focus, movement, motivation, and reward. I have a full video breaking down exactly what dopamine does and why it matters for your brain linked above. But the short version is this: both ADHD and Parkinson's involve dopamine problems in different brain regions. In ADHD, dopamine signaling is underactive in the prefrontal cortex and striatum, your attention and decision-making areas. That's why stimulants work. They boost dopamine there. In Parkinson's, dopamine-producing cells in a deeper structure called the substantia nigra slowly die off. Lose enough of them and you get the tremors, the stiffness, the shuffling walk. The connection? Both conditions affect overlapping circuits in the basal ganglia, your brain's command center for thought and movement. Imaging studies show people with ADHD already have differences in their dopamine transporter, the same protein that breaks down in Parkinson's. It goes deeper. Rare genetic variations in PARK2, a known Parkinson's risk gene, show up more often in ADHD patients. Mutations in the dopamine transporter gene itself have been linked to both ADHD and adult Parkinson's in the same families. But here's what most people miss. When scientists use the most rigorous genetic method available, Mendelian randomization, to test whether ADHD actually causes Parkinson's, they found no direct causal relationship. The genetic correlation was actually weakly inverse. These conditions share biological wiring, but one doesn't necessarily cause the other. Understanding this kind of overlap between your brain chemistry and your long-term health is exactly what we focus on with our patients at Bespoke Concierge MD, because your ADHD doesn't exist in a vacuum, which raises the real question: what about the medications? This is a chapter I told you to stay for, because this is where the story flips. Does taking Adderall or Ritalin at a normal prescribed dose cause Parkinson's disease? Based on the best available evidence, no. The data suggests the opposite. A retrospective study tracked ADHD adults over 50 for up to 30 years. Patients on prescribed stimulants had a 58% lower hazard, meaning risk over time of developing Parkinson's compared to ADHD patients not on stimulants. A separate team used AI to screen pharmaceutical databases for potential Parkinson's prevention drugs. Amphetamine flagged as a candidate. The clinical data confirmed it. Prescription amphetamine users had a hazard ratios of 0.55 to 0.59 at multiple follow-up points, meaning roughly 40 to 45% lower risk. The FDA's adverse event reporting system, collecting millions of drug safety reports, has never flagged Parkinson's as a signal for these medications. A 2025 meta-analysis of 93 clinical trials in JAMA Network Open found stimulants increased some minor side effects, but Parkinson's wasn't among them. And structural brain imaging of adults on stimulants found zero evidence of damage to the substantia nigra. Now, if you want to understand how stimulant medications actually work in your brain and the different choices for ADHD, I made a full overview video breaking down each one linked above. So if the meds aren't the problem, why did those headlines happen? That answer requires understanding one of the trickiest traps in medical research. Here's where the confusion starts, and it trips up even doctors. The University of Utah found that ADHD patients prescribed stimulants had 8 times the risk of basal ganglion diseases, including Parkinson's, compared to controls. Headlines ran with it, but the researchers themselves said something the articles buried. The patients who get prescribed stimulants typically have more severe ADHD, and more severe ADHD all by itself already carries higher neurological risk. This is a classic research problem called confounding by indication. The sickest patients get the strongest treatment. So comparing treated versus untreated groups doesn't test the drug, it tests disease severity. More evidence that medication isn't the driver. A large Israeli study specifically checked whether ADHD medication use changed Parkinson's risk in subgroup analysis. It did not. And siblings of ADHD patients who never took stimulants also have elevated neurological risk. The vulnerability runs in families independent of any pill. But there is one type of stimulant use that genuinely increases Parkinson's risk. That distinction is critical. This might be the most important distinction in this entire conversation. Prescription stimulants at therapeutic doses are not the same as methamphetamine. The dose is different. The mechanism is different. The outcomes are completely different. Meth abuse increases Parkinson's risk by roughly 2 to 3 times. Why? High-dose meth directly poisons dopamine neurons, causing dopamine depletion, alpha-synuclein clumping, mitochondrial breakdown, and oxidative stress. These are the exact pathways that drive Parkinson's. But animal studies testing methylphenidate at prescription equivalent doses, no dopamine cell death, no toxic byproducts. When someone online says amphetamine causes Parkinson's without making that distinction, they're either ignorant of the facts, trying to scare you, or too dumb to understand the distinction. So with all this data, should you still be taking your ADHD meds? If you're thinking maybe I should just stop my Adderall to be safe, I understand that impulse. I felt it too when I first heard the statistic. Based on the full body of evidence, clinicians should not withhold or change ADHD medication based on Parkinson risk. That's not opinion, that's what the data supports. Prescription stimulants don't increase Parkinson's risk. Multiple studies suggest they may be protective. And untreated ADHD carries its own serious risks, higher rates of substance abuse, accidents, cardiovascular stress, and chronic mental health burden. For those on non-stimulant medications like atomoxetine, guanfacine, or clonidine, there's no Parkinson's risk signal either. Atomoxetine has actually been studied in Parkinson's patients and improved executive function and impulse control. The medication question has a clear answer, but you still need the right monitoring. Here's what that looks like. If you have ADHD, especially over 40, there are some evidence-based symptoms to watch for. Motor symptoms include new tremor at rest, muscle stiffness, slowed movements, handwriting changes, reduced facial expression, and balance problems. Non-motor symptoms that often appear first: new memory problems, difficulty planning, unexplained mood changes, sleep disruption, or sudden loss of smell. I have a full video breaking down the early warning signs and symptoms for Parkinson's linked above. Identifying Parkinson's early can make a world of difference in treatment outcomes. If you're over 50 with ADHD and family history of Parkinson's, an annual neurological check-in is reasonable. At Bespoke, we actually build this kind of proactive neurological screening into our patient care because catching something early is always better than catching it late. And the single most evidence-backed brain protective strategy, it's all about your lifestyle choices, starting with regular physical exercise paired with quality sleep, a nutrient-dense diet, and avoiding neurotoxic substances. I made a full video on how exercise and lifestyle factors can help prevent Parkinson's disease. I'll link that right here too. It's a must-watch if this topic matters to you. ADHD and Parkinson's disease share the same dopamine wiring. Having ADHD does modestly increase your statistical risk, supported by data from over 1.8 million people. But your prescription stimulant is not the cause. The best evidence shows Adderall, Vyvanse, and similar medications taken at prescribed doses do not increase Parkinson's risk and may help prevent it. What you need isn't fear. What you need is a doctor who understands this research, can evaluate your personal risk, and manage your ADHD with the full picture in mind. That's exactly what we built Bespoke Concierge MD to do. We're a concierge medical practice designed for people who want real answers, not a rushed 10-minute appointment. If you have ADHD, if you're thinking about long-term brain health, or if you want a physician who actually reads these studies, we'd love to work with you. The link to learn more and join is right below this video. And if this helped, share it. Someone you know is Googling this alone at midnight and they deserve a real answer. Drop a comment and tell me, how long have you been on ADHD medication, and has anyone ever talked to you about long-term neurological health? I read every comment. If you're like me and have ADHD and you're worried about monitoring for Parkinson's disease, The video on the right is a breakdown of the early warning signs for Parkinson's. These can appear 10 to 20 years ahead of the disease. The playlist on the left covers Parkinson's disease topics in detail, like prevention, treatment, and where the science is going. And hit subscribe. I publish evidence-based medical content every week that could change your life. See you in the next video.